Welcome to another episode from the Veterinary Research Channel. Today, we're diving into some fascinating research that explores a potential factor influencing how well dogs with lymphoma respond to chemotherapy. As many of you know, lymphoma is a common cancer in our canine companions, and while multi-drug chemotherapy, including glucocorticoids like prednisone, is a standard treatment, sometimes the effectiveness of this treatment can vary. Researchers have been investigating why this might be the case, and one area of interest is the role of a natural steroid hormone called cortisol. This particular study looked at the connection between the amount of cortisol present in a dog's blood at the time of diagnosis and how successful their chemotherapy treatment was. The researchers started with the understanding that when cortisol levels are high for a sustained period, it might actually make cancer cells less sensitive to glucocorticoid drugs, a phenomenon known as glucocorticoid resistance. This resistance could happen because high levels of cortisol might cause a decrease in the number of places on the cancer cells, called glucocorticoid receptors, where these drugs can attach and exert their effects. Think of it like having fewer parking spaces available. Fewer drug molecules can bind and do their job of fighting the cancer. Furthermore, previous research has also suggested that a protein called P-glycoprotein, which can pump drugs out of cells, might also play a role in treatment resistance. While glucocorticoids themselves can sometimes increase the activity of this pump, the current study specifically wanted to understand if naturally occurring high levels of cortisol before treatment could impact chemotherapy outcomes in dogs with lymphoma. So, the main question these researchers wanted to answer was, is there a relationship between the concentration of cortisol in a dog's blood when they are first diagnosed with lymphoma and how well they respond to chemotherapy? They hypothesized that dogs with higher levels of this natural steroid hormone might have poorer outcomes from their chemotherapy treatment. This is a crucial question because if we can identify factors like this beforehand, it could potentially help us better understand prognosis and perhaps even tailor treatments in the future. The study aimed to contribute to our understanding of why some lymphomas are more resistant to treatment than others, and to explore if measuring cortisol levels could be a useful tool for predicting how a dog might respond to chemotherapy. Now, let's turn things over to Brian to discuss what the researchers actually found.
Thanks, Emma. So, the researchers in this study looked back at the medical records of 30 dogs that had been diagnosed with lymphoma and treated with chemotherapy. Importantly, they had measurements of the cortisol levels in these dogs' blood taken at the time of their diagnosis, before any chemotherapy had started. Based on these cortisol levels, the dogs were divided into two groups. One group with normal cortisol concentrations and another group with high cortisol concentrations. When they compared the two groups, the researchers didn't find any significant differences in things like the dog's age, weight, the specific type of lymphoma they had, or the initial chemotherapy protocols they received. This suggests that these other factors were fairly balanced between the groups, allowing the researchers to focus more specifically on the impact of cortisol levels. However, when they looked at how well the dogs responded to chemotherapy, they found a significant difference. The dogs in the high cortisol group had a notably lower overall response rate to the chemotherapy compared to the dogs in the normal cortisol group. This meant that a smaller percentage of dogs with high cortisol levels experienced a significant reduction or disappearance of their cancer after the initial rounds of treatment. The researchers also looked at how long the dogs lived without their cancer progressing, which is called progression-free survival, and their overall survival time. The results here were also significant. Dogs with high cortisol levels had both a shorter progression-free survival and a shorter overall survival compared to the dogs with normal cortisol levels. This indicates that not only did they respond less well initially, but their cancer was also more likely to progress sooner and they tended to live for a shorter period overall. Interestingly, the study also found that the dogs in the high cortisol group had significantly higher levels of an enzyme in their blood called alkaline phosphatase. When they further investigated this, they found that specific types of alkaline phosphatase, those originating from the adrenal glands and the liver, were also increased in the high cortisol group. Additionally, the size of the dog's adrenal glands, which produce cortisol, was found to be significantly larger in the high cortisol group when measured using ultrasound. This finding supports the idea that these dogs might have been producing more cortisol. Finally, the researchers examined tumor samples from the dogs to look at the presence of the P-glycoprotein drug pump and the glucocorticoid receptors we mentioned earlier. While they didn't find a significant difference in the amount of P-glycoprotein between the two groups, they did find a crucial difference in the glucocorticoid receptors. The number of cancer cells with detectable glucocorticoid receptors was significantly lower in the dogs with high cortisol levels. This finding lends support to the idea that high levels of cortisol might be leading to a downregulation or reduction in these receptors, potentially making the cancer cells less sensitive to glucocorticoid drugs used in chemotherapy. So, what do these findings mean? The researchers concluded that their data suggests that measuring cortisol levels in dogs with lymphoma at the time of diagnosis could potentially serve as a prognostic factor, meaning it could help predict how well a dog might respond to chemotherapy. It could also be an evaluation index, providing valuable information for clinicians. In their discussion, the researchers considered several possible explanations for these findings. They noted that while none of the dogs in the study had a history of receiving prednisone before diagnosis or showed obvious signs of a condition called hyperadrenocorticism where the body produces too much cortisol, the increased cortisol levels could have been a result of factors like severe stress, aging, or the presence of the lymphoma itself. Previous research has shown that chronic stress, for example, can lead to enlargement of the adrenal glands and increased cortisol production. This sustained high level of cortisol could then lead to the observed decrease in glucocorticoid receptors, resulting in resistance to glucocorticoid-based chemotherapy. The researchers acknowledged that their findings regarding alkaline phosphatase differed from some previous studies that didn't find a link between a specific type of alkaline phosphatase and prognosis in canine lymphoma. They suggested that differences in study design, patient selection, and measurement techniques could have contributed to these discrepancies and highlighted the need for further research in this area. Regarding the proteins they examined, the fact that P-glycoprotein levels weren't significantly different between the groups suggests that, in this study, this drug pump might not have been the primary factor influencing the poorer chemotherapy outcomes in dogs with high cortisol. However, the significant decrease in glucocorticoid receptors in the high cortisol group strongly supports the idea that this reduction in receptors could be a key mechanism behind the reduced sensitivity to treatment and poorer survival observed in these dogs. This aligns with findings in both human and veterinary medicine suggesting that the presence and function of these receptors are important for how well glucocorticoid drugs work. The researchers also discussed some limitations of their study. It was a retrospective study, meaning they looked back at existing data, and the number of dogs included was relatively small. Additionally, while all dogs received initial multi-drug chemotherapy, the specific supportive or end-of-life care they received after initial treatment failure could have varied slightly between different veterinary hospitals. They also noted that a particular breed, the Shiba Inu, was more represented in the group with intestinal lymphoma, which some studies have linked to a potentially worse prognosis. However, they pointed out that overall, other known prognostic factors were well balanced between the normal and high cortisol groups. Despite these limitations, the researchers believe their study provides valuable initial insights into the relationship between cortisol levels and chemotherapy outcomes in dogs with lymphoma. Their findings emphasize the potential importance of considering cortisol concentrations when assessing and planning treatment for this common cancer in dogs. However, they stress that more research is needed to confirm these findings and to further investigate the precise mechanisms by which high cortisol levels might impact chemotherapy response. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.